Monday, December 6, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at an article entitled Management of Surgical Wound Dehiscence by Oxygen-Ozone Therapy in an FIV-Positive Cat, a case report. It comes to us from Romania and was accepted in May of 2020. Another quick note, our friend Dr. Kalin from Romania was part of putting this article together. So let's take a look at what happened. After 13 days following the surgery with allopathic treatment and no improvement, oxygen-ozone therapy, which again is just a more scientifically correct term for ozone therapy, was started. Clinically, oxygen-ozone therapy showed significant results after the first session. So let's take a look at what they did to get those results. First, before we get into that, ozone therapy has been proposed in the late 20th century to be a very effective therapy capable of inducing the redox balance, and it is considered to be a therapy with good results in multiple acute or chronic diseases. At precise doses, it acts like a local antiseptic, tissue oxygenating agent, and epithelialization promoter by accelerating the release of platelet growth factors. So that's one of the ways it can work. So we're going to now jump into the case history and look at what they did. First of all, just so you know, they did a lot of things allopathically, and it didn't work. So they're trying to treat this issue. They finally amputated the leg, and then they ran into some problems. The evolution of the wound was unsatisfactory, and the dehiscence, rejection of the suture material, and superficial necrotic processes began 4 days after the surgery. After 6 days, the wound was completely opened. So we've got an issue there, right? And you've all seen those types of wounds. After 14 days of allopathic treatment, the decision to perform ozone therapy by perilesional and intralesional infiltrations was made. Unfortunately, that decision wasn't made on day one, but at least it was made. The concentration of ozone was 15 micrograms per milliliter, injected 1 to 1.5 milliliters and in multiple points around that or into that wound area. And then they also injected some gas, not to exceed 10 milliliters, into the necrotic pectoral and intercostal muscles. So the treatment took place once every 48 hours until complete epithelialization. The most extensively described, so we're going to look at a little bit of information outside of this study. The most extensively described mediators involved in wound healing processes are cytokines and growth factors. But if the animal's immune system is very weak, there will be a lack of migrating leukocytes at the site of the wound. So the isolation of bacteria and removal of cellular debris will be ineffective or inefficient. However, oxygen-ozone therapy showed quick improvement after the first session of the dehiscent wound, whereas several attempts of classical therapy had no effect, and the general condition of the cat worsened. So we're seeing how ozone significantly impacted the trajectory of this case. Complete healing of the wound occurred after 22 sessions. Now we're talking complete healing of ozone therapy. That lasted for 1.5 months. That's a long time, but read this. A higher healing percentage was observed in the first 6 days. So you can imagine that the owners of this cat were very excited about just the fact that it was healing, which they hadn't been able to do. Those wounds can be very difficult to deal with. So this is a great case that no other systemic or local antimicrobial treatments were used. The effect of ozone over tissue is forced oxygenation and accelerated release of platelet-derived growth factors. So that's what's really taking place when we see ozone healing a wound like this. In terms of its antiviral properties, ozone damages the viral capsid and stops the viral division by peroxidation processes. The result of this case report suggests that ozone improves the local peripheral vascularization, accelerates granulation tissue expression, and quickens the contraction phase of chronic wound healing. From this standpoint, oxygen-ozone therapy should be considered as an alternative treatment of choice in veterinary medicine in patients with chronic non-healing wounds. All right, so there you have it. This has been 5 Minutes of Proof. We look forward to seeing you next week.